Okay, my friend, thank you. Thank you for coming and thank you for letting us have this video conversation. It's important because everybody wants to know it's possible to come for this operation and it is doable. So, can you please share your thoughts with us? You are living in Norway, right?
Yeah.
And Norway, it's not an easy decision. Why did you come from Norway for this operation? And how did you choose? How did you choose our center?
So I had difficulties with pain sometimes,
Yeah.
and also my libido was low.
Yeah.
And I went to the doctor to check it out. What was the issue? Because I had a feeling maybe.
How old are you?
I'm 24.
Yeah, 24 years. You don't have to have any libido changes, but sometimes with varicocele it is happening.
That might happen, and the pain was most important.
Yeah, pain, of
when
course.
they came,
Yeah.
so I went to the doctor. I said, "What's this?" I wanted to have it checked out.
Yeah.
And then he checked out and he said it's no problem, but I was insisting. So he sent me to like Nordic.
This is a family doctor?
No, the general
Okay.
hospital.
Not urologist.
No, the general hospital. He sent me to this imaging,
Yeah.
and there they find out.
Okay.
So in the beginning he couldn't in the beginning see that
Yeah.
it was very possible.
Normally in these developed countries, the system is very good for ordinary system. But if you have a special disease, if you have some kind of rare disease, it changes too much and it's very difficult to find the final solution. Then?
And then I found out through the test that it was bilateral varicocele.
Okay.
So that's where I started to do my research.
You begin to search varicocele and
Exactly.
did you find us from YouTube?
Exactly.
Okay, I am using YouTube. I don't post so much posts in Instagram because, you know, YouTube is only for those who write varicocele, who are looking for it and interested in this. But for example, in Instagram, there is a post coming to anyone who is not caring varicocele, who is not interested in this. So I want to reach to people who are interested. So then you understand that we have a special technique, right?
Exactly.
Did you understand? We are removing the veins.
Exactly. I saw it. I did the research about other techniques and the reoccurrence rate, and also, yeah, I felt like this was the best option due to the reoccurrence being higher in other techniques.
Actually, when I first studied urology, the recurrence rate for microscopic varicocele surgery was 2%, 3%. I said, oh, nice. And I learned how to use the microscope, and I started doing microscopic surgery, but the recurrence was 30%. It is not true what's written in the literature about the recurrence rates. They are not updated results. And also for embolization, for laparoscopic surgery, for robotics, which is not involved in this surgical field yet, I tried all of them, but the recurrence rate is always 30%, and this is because the veins are there, they are ligated, they are supposed to disappear by time, but they are not disappearing. So we are lucky that you didn't have the first surgery. Normally I have patients who did the first surgery, and then when it fails they find me after embolization, after open surgery, after every kind of surgery. It's always more difficult to do the second surgery, but in your case it was easy and we can take out many veins. I'm saying this because people come to me and they request, take out these big veins, doctor, please, I came here to take my veins out. But if they had a previous surgery, the tissues are not fresh, and sometimes it's not possible. Only we take out small veins and then we make suture ligation through the veins and not ligated in one part, many part, and there is no residual vein anymore, but they are looking for long big veins. You had them. I am happy that we could give them to you. And Then when you plan, it's of course easy to find the way to come to Turkey from European countries. It is easier, and your home country is Ethiopia, right?
Exactly.
Habeshistan.
Yes.
You call it which one, Habeshistan or Ethiopia?
Yeah, Ethiopia.
Okay, so people also come to me from Ethiopia too, but of course coming from Norway is easier. Ethiopia is also easier. The biggest airport in Africa is in Ethiopia, Addis Ababa, right? I learned many things about Africa in the last years. Okay, so did you find it easy and doable? What's your recommendations and comments?
Yeah, I find it really convenient. I came here, I got a perfect treatment. I was a bit nervous about the whole process, but everything has been good for me.
Yeah.
Yeah, and it was really like, I feel like, especially with OPC, I feel like it's important because it can lead to more severe consequences. I was glad I did it.
That's true. And the hotels, the travels,
It was fun.
always, all of them is doable, right?
Yeah,
Convenient.
of course.
And after the procedure, now you are operated on Friday, Saturday you're the first day, Sunday second, and you are in third day.
Exactly.
How do you feel when will you go back? When is your return flight?
Tomorrow.
Tomorrow. So do you feel yourself enough confident to go back?
Yeah.
Okay. And if people are coming from long distance countries like 12-hour flight and some connections in between, I can say they have to spare Turkey 6 days, for example.
Exactly.
But for you, you arrived at Thursday,
Exactly.
and you will go at Tuesday, like 5 days you spent here. It's also enough, and this for the bilateral surgery. Again, if it's a secondary case, if they are operated previously, not embolization, but with normal open surgery, microscopic surgery, the healing may be a little more challenging. There may be more swelling in the testicles. We can put drainage tubes inside the scrotum sometimes, and their healing is a little more longer, but it's doable. Thank you for sharing this. Do you have any advices for us, for those who will come and think?
No, I just say do it.
Yeah, thank
It's
you.
worth it.
Yeah, and yeah, it is doable, and from other countries also people can come and have this operation.
Yes.
Did you like the hospital?
Yeah, I think everything was fine. They treated me good. It
Okay.
was fine.
Okay, there are perhaps people ask me questions about the hospital qualities. We select for you the most economic hospital actually, and it is still doable.
Yeah, of course.
It is
Quality.
good quality. The nurses are good. They are used to this operation because we do it many times. And there are the more quality hospitals, when you go in them, oh, it's like a hotel, okay? It's fun, the fancy looking. But for me, the operation part is same. So there is no, nothing, no difference.
Yeah.
Thank you. Thank you
so
very
much.
much.
Okay.